Ascites means collection of fluid in the abdomen. We will see the evaluation after paracentesis. The ascitic fluid is evaluated and SAG is calculated. SAG is serum ascites albumin gradient. Serum ascites albumin gradient. It is calculated by ascitic albumin minus serum albumin, and if the value is more, sorry, if the value is less than 1.1 gram per deciliter, then the causes of ascites will be pancreatitis, peritoneal carcinomatosis, tuberculosis, or nephrotic syndrome. But if the SAG value is more than 1.1 gram per deciliter, then we can see ascitic protein. If ascitic protein is less than 2.5 gram per del or more than 2.5 gram per del, in this uh, uh, if the if this SAG is less than 1.1, then it signifies that the cause is not a portal hypertension, and if the SAG value is more than 1.1, then the cause of this ascites is portal hypertension. In this we will see ascitic protein. Ascitic protein signifies that the um, protein is flowing freely through the hepatic sinusoids or not, means involvement, hepatic sinusoids involved or not. If the protein is less, means hepatic sinusoids are involved and protein are not able to flow freely. And if protein is more, that is more than 2.5 gram per del, then hepatic sinusoids are not involved, they are normal. So if the ascitic protein is less than 2.5, then we will see what are the conditions which lead to ascites, that is cirrhosis, massive liver metastasis, and late Budd-Chiari syndrome. And if ascitic protein is more than 2.5 gram, then the cause of ascites will be heart failure, that or congestive pericarditis, early Budd-Chiari syndrome, or IVC obstruction. Then we will see the treatment of ascites. For the treatment, the first we should restrict the sodium in the diet to 2 gram per day, means restricting sodium in the diet for 2 gram per day. Yes. Second, we have to give the diuretics. Most commonly preferred diuretics for ascites is spironolactone plus furosemide. Maximum dose can be given up to 400 milligrams, and the furosemide maximum dose is 160 milligrams. Spironolactone mechanism of action, it is, we know that it is an aldosterone antagonist, and it reabsorb the uh, sodium from the DCT, that is distal convoluted tubule in the kidney. But the use of spironolactone is limited because of its side effect, mainly gynecomastia. And if gynecomastia has occurred, then spironolactone is replaced by amiloride, and dose is 5 to 40 milligrams. ठीक है. And we know that the furosemide is a loop diuretics. Then this, if this combinations is uh, not able to control ascites, then the condition is known as refractory ascites. And for the treatment of refractory ascites, we have two drugs. First is midorine, which is an alpha 1 adrenergic antagonist, and second is clonidine, that is alpha 2 adrenergic antagonist. These are both basically vasoconstrictors, so they counteract on the splanchnic vasodilation and useful in the ascites. These are combined with the diuretics, and after this treatment also, this refractory ascites is um, not improved, then we can go for LPV and TIPS. What is LPV and TIPS? LPV is large volume paracentesis, and TIPS is transjugular intrahepatic peritoneal shunt. TIPS, transjugular intrahepatic peritoneal shunts. By this we can treat the ascites. Thank you.